My name is Ajay Bhatnagar. I've been with Oxley's for a good 16, 17 years. Started off as an SHO, then I was an associate specialist, then a consultant psychiatrist for many years in Greenwich. Then I moved to Bromley, and then currently clinical director in Greenwich since August of 2020. A year that I'm sure everybody will remember. I was working on Norman Ward when I got the virus. But before I tell you about how I got the virus, I mean, should say that I was quite a fit man. Never took a single day off sick from work in my entire career, and was very proud of that. Would tell my juniors and and colleagues that look, I'm fit, and I would go to the gym 3 4 times a week. Um, and in fact, it was after a session in the gym that I had come home and I began to shiver and wasn't sure what it was, whether it was a urinary tract infection or malaria, because I had come back from India as well a little while before that. Couldn't really figure out. Was very nervous about getting it checked because there was COVID that had just come into UK at that point. From somebody who's been fit always to then find himself being ill, being driven to the A&E by my wife. I get told, look, your lungs are in very bad shape, you have very poor oxygen saturation, you need to wear a mask. And that was the first time I had worn a mask in my life. um, and then put on a wheelchair and sent into this room, which was the isolation room. And then my oxygen saturation declined further. I was put on 15 liters of oxygen. That didn't work. They had to then move me to the ITU, and I was in ITU for a long, long time on a ventilator. And I must say that was one experience. I guess it'll be very hard to overcome and to forget. It's like being on a different planet with everybody in masks and gowns and visors, and you can't really see anybody as a human. It's like genuinely, it's like being on a different planet. And when people complain about lockdown and being at home and feeling lonely, I must say that experience of being in hospital is truly isolation. Is truly cut off from your family, friends, everybody, and nobody looks like they generally would. In the full PPE, the only thing that you see is people's eyes, and you're not sure whether you're going to make it or not. And sometimes you also get certain comments from, say, staff that not sure what the prognosis is, but we will try our best. So I wasn't sure whether I would come out alive, but I did, and I was then told, look, you've got very bad clots in your right side of the right leg, basically from the groin down to the calf, and the clots which could move up to the lungs, move up to the heart. So that was also a very scary period at home for months together, thinking what could be happening to those clots, whether the clots are going away or they're still there. Was put on injections. First time again in my life having injections that regularly, twice a day. And that went on and on for a long time. So it was an ordeal for me. It was an ordeal for my wife, for my kids, for my friends. It wasn't an experience that I would say, one would ever or can imagine. So the point I guess I'm trying to make is, if one had to choose between the virus and the vaccine, the answer is very simple. The virus is unpredictable. I thought I was fit. I thought no illness could touch me. This virus completely took over my life. It was a surprise, and then what it's doing is devastating. When I hear in the news that every 30 seconds somebody is being admitted to hospital, it just makes me think that, gosh, the life in the hospital for those patients is bad, is something else, and one should never take a chance and find themselves in a situation that I was in. I was lucky I survived. Being from a BMA background, I do have that predisposition to the illness anyways. But if there is a vaccine that's well researched, if there is a vaccine that's has shown to be so effective in all the trials, one should go for it. One should not take a chance with the virus. There are lots of people who have mild symptoms, and nothing really happens to them, and they are all right. But then there are those where their life goes completely upside down, not only for themselves but for their families. So I would say it's an easy choice. Go for something which is well tried, evidence based. The vaccine doesn't have the virus. If I have to assure anybody, the vaccine does not have the virus. The vaccine does not cause COVID. So the whole idea is to prepare our bodies to be able to fight the virus when it attacks you. So I've been infected previously, as I just mentioned, but I went for the vaccine and had my first dose because just having had the infection doesn't really mean that I've got antibodies, indefinitely, and I'm protected. I am prone to reinfection. So I'd advise very strongly, protect yourself, get the vaccine. Do not go through what I went through. Do not go through what people are going through. What families are going through. Uh, this vaccine will only mean good health and protection. Thank you.